So today what I'm going to do is I'm going to go ahead and do a Subq injection and how, and my steps and how. So first thing is first is basically I would before I perform hand hygiene, I'm going to go ahead and verify the order. See, check the rights of medication administration and verify the order. And then secondly, I'm going to verify pertinent data. So I'm going to things up anything the patient has on file, like vital signs, labs, just to make sure that they're okay to take that medication. And then since I'm gonna be with my instructor, I'm gonna go ahead and explain the purpose of the medication, the assessment criteria, and the teaching, and then the adverse effects of the medication, which in this case is gonna be insulin. And then I'm gonna go ahead and gather my supply. So sometimes patients have their own insulin in hospitals, like on Fountain Valley, like patients in their cubbies, they have their own insulin with their own name on it. Other hospitals may not. So I'm gonna grab the insulin. So right here, basically it says right here that I'm gonna be doing a medication administration for regular insulin, which is 1 unit and 0.01 ml, and the blood sugar for this patient is gonna be for 275. So if you look at the scale right here, 275 is gonna be 6 units. So I'm gonna grab all my supplies. So I have regular insulin right here. You can see that. I'm gonna go ahead and perform hand hygiene. Okay, I'm gonna don my gloves. I'm just gonna open this like that. So 6 units. So before I do that, the type of needle for this that I'm gonna use, this one's gonna be, right now I have a 28 gauge. Typically for insulin, the type of gauge that you're gonna have is from 25 to 30 gauge, but I have a 28 gauge, which falls into the criteria. And for this, the needle size, the needle size itself is very small, so this is 1.5 inch. Okay, so I'm gonna go ahead and get the air out first. I'm gonna do 6. Alright, so right here I have 6. I don't know if you could tell, but it's 6. So right now we're gonna put the air into the insulin. Okay, so I'm gonna go ahead and clean this. Okay. Take this off right here. And do that. Put the air in upside down. I'm gonna go ahead and get 6. Okay. I'm gonna make sure there's no bubbles. If there's bubbles, then I would just smack it. Make sure the bubbles are out. Okay, I'm gonna take it off now. And then I'm gonna recap. Okay. And then what I'm gonna do is I'm gonna go ahead and go with another nurse to make sure that I have 6 units of insulin. So right here is gonna be the 6 units of insulin. So my camera person here is gonna check, and is that right? So my camera person is gonna check, and she says it's right.
Yeah, it's right.
So after she checks, another nurse checks for the insulin. You always have to have another person check for insulin. You always have to. So once that's done, I'm gonna go ahead to the patient. I'm gonna have the patient verify their first and last name and date of birth, and then or scan their thing. But also I gotta verify. They have to verbally state their first and last name and date of birth. And then I'm gonna tell them like what I'm giving them. So I'm gonna be like, I'm gonna give you insulin. So basically this is what it's gonna lower your sugar levels. And then I'm gonna go ahead and pick an injection site, or sometimes you can ask the patient if they have a preference for injection site for Subq. So what I'm gonna do is I'm gonna go ahead and do the injection site, which is gonna be right here on the bottom. So this is like my dummy hand. So I'm gonna get this. I'm gonna go ahead and clean the site, and then I'm gonna do this you could do this either at a 45 to 90 degree angle. So I'm gonna put this on like that. So it's gonna be kind of hard. Like that. And then you could pinch, like pull the skin like that. So I'm gonna take this off. Stay. Okay. Pinch the skin, and then go, and then wait a minute for the medication to set in, and then take it off, and then have the needle, and then you're gonna let go once the needle's out. You're gonna let go of pinching the skin, and then you can put gauze if you need to if they're bleeding. Sometimes they're bleeding, sometimes they're not. And then recap the needle, and then put this on the biohazard, and then clean up all your supplies, and you're done.